Welcome. Today we're diving into a condition that affects the optic nerve, the crucial pathway between your eyes and your brain. Papilledema. We'll explore what causes it, how it's diagnosed, and what can be done to manage it. This video is for educational purposes only and doesn't substitute for professional medical advice. If you're experiencing any vision changes or headaches, consult a healthcare provider immediately. Papilledema isn't a disease itself, but rather a sign of an underlying medical condition that's causing increased pressure within the skull, known as intracranial pressure. A multitude of conditions can lead to this increase. Brain tumors, both cancerous and non-cancerous, are a major cause. Infections of the brain, such as meningitis or encephalitis, can also trigger it. Bleeding in the brain, whether from trauma or a ruptured aneurysm, can elevate intracranial pressure. Less common causes include blood clots in the brain's venous sinuses, a condition called hydrocephalus where there's excessive fluid in the brain, and even certain medications. In some instances, particularly in overweight women of childbearing age, a condition called idiopathic intracranial hypertension, or IH, can occur, meaning the cause of the elevated pressure is unknown. To understand papilledema, we need to visualize the optic nerve. It exits the eye through a small hole in the back of the eye called the optic disc. When intracranial pressure rises, it squeezes the optic nerve. This compression disrupts the normal flow of fluids within and around the nerve. The pressure also obstructs the tiny blood vessels supplying the optic nerve. This combination of compression, fluid buildup, and impaired blood flow causes the optic disc to swell, leading to the characteristic appearance we call papilledema. The prevalence of papilledema varies depending on the underlying cause. In general, it's considered a relatively uncommon condition. Idiopathic intracranial hypertension, or IH, is the most common cause of papilledema, particularly in overweight women of childbearing age. Studies estimate the incidence of IH to be around 1 to 2 per 100,000 people, with a much higher incidence in the at-risk population. The prevalence of papilledema caused by other conditions, like brain tumors or infections, is tied to the prevalence of those specific conditions themselves. The symptoms of papilledema can vary depending on the severity and the underlying cause. Early on, some people may not experience any symptoms at all. However, as the condition progresses, symptoms can include transient visual disturbances, such as blurring, dimming, or double vision, often lasting only a few seconds. Headaches are a common symptom, often described as throbbing and worsening with coughing or straining. Nausea and vomiting can also occur, particularly with conditions that cause a rapid increase in intracranial pressure. In severe or chronic cases, papilledema can lead to permanent vision loss, including peripheral vision loss, or even blindness. Diagnosing papilledema involves a thorough eye examination by an ophthalmologist or optometrist. The key finding is swelling of the optic disc, which can be seen using an ophthalmoscope. To confirm the diagnosis and determine the underlying cause, further tests are typically needed. These may include visual field testing to assess peripheral vision, optical coherence tomography, or OCT, to measure the thickness of the optic nerve fiber layer, and imaging studies like MRI or CT scans of the brain to look for tumors, bleeding, or other abnormalities. A lumbar puncture, also known as a spinal tap, may be performed to measure the pressure of the cerebrospinal fluid and analyze its composition. This is particularly important in cases of suspected idiopathic intracranial hypertension. Papilledema isn't typically classified into distinct types, but rather graded based on its severity. The modified Frisson scale is a common grading system, ranging from grade 0 normal optic disc to grade 5 severe papilledema with significant optic disc swelling and obscuration of blood vessels. The grading helps monitor the progression or resolution of the swelling over time. The treatment for papilledema focuses on addressing the underlying cause. If a brain tumor is the culprit, surgery, radiation therapy, or chemotherapy may be necessary. Infections require prompt treatment with antibiotics or antiviral medications. For idiopathic intracranial hypertension, treatment often involves weight loss, medications like acetazolamide to reduce fluid production in the brain, and in some cases, surgical procedures such as optic nerve sheath fenestration or cerebrospinal fluid shunting to relieve pressure. Regular monitoring of vision and optic disc swelling is crucial to ensure the treatment is effective. Preventing papilledema primarily involves managing the risk factors for conditions that can cause increased intracranial pressure. Maintaining a healthy weight can help reduce the risk of idiopathic intracranial hypertension. Prompt treatment of infections and avoiding head injuries are also important. If you have a family history of conditions that can cause papilledema, such as brain tumors, discuss screening options with your doctor. The prognosis for papilledema depends heavily on the underlying cause and the promptness of treatment. If the underlying condition is treated effectively, the papilledema can often be reversed and vision can be preserved. However, delayed or inadequate treatment can lead to permanent vision loss. Recent research has focused on developing more effective treatments for idiopathic intracranial hypertension, including new medications and minimally invasive surgical techniques. Studies are also exploring biomarkers to help identify individuals at higher risk of developing EDH and to predict the response to treatment. Ongoing research aims to improve our understanding of the pathophysiology of papilledema and develop more targeted therapies to protect vision.